In this lecture, we will discuss adverse effect and different type of adverse effect due to drugs. Adverse effect. Harmful and unwanted effects of drug are considered as adverse effects. When we talk about the adverse effect, that means they are always undesirable and unintended. Adverse drug event, any untoward occurrence which may occur during medical treatment, does not necessarily have a causal relationship with the treatment. These are adverse drug event. So incidence of adverse effect is more common with polypharmacy, means use of more than 3 to 4 drugs. Then elderly, again, adverse effects are more common as there are use of many drugs due to different comorbid condition. Then in children's, adverse effect again very common because their metabolizing capacity is limited and not very well developed. Then patient with multiple disease, pregnancy, malnourished children, immunosuppression, drug abusers, drug addicts, adverse effect are again very common. So adverse effect can develop immediately when we give the drug, or they can appear after a prolonged medication or after stopping a drug. Grading of severity of adverse effects. Most of the time, the area adverse effects are minor and they doesn't require any therapy, antidote, or they don't causes the prolongation of hospitalization. But in certain instances, they can be moderate and require change in the drug therapy. They may require specific treatment or prolong the hospital stay. Uh, Sometimes the adverse effects may be severe type, like may potentially threaten the life or cause permanent damage or require intensive medical treatment. The adverse effect can be lethal when it causes the death of the patient. So how we classify the adverse effect? Adverse effect can be type A, type B, type C, type D, type E, and type F. Broadly, we can classify the adverse effect as a predictable or non-predictable. Predictable when it is based on pharmacological properties, and non-predictable based on immunological response and genetic makeup of person. So type A, that is augmented. These are based on pharmacological properties of drug. So these can be predictable. Most common type of adverse effect are this category, and responsible for 75% of the total ADR. These are dose related and can be preventable. For example, anti-diabetic drug. The pharmacological role of the anti-diabetic drug like insulin is to decrease the glucose. But when a person miss the dose or take the more dose of insulin, it will result the hypoglycemia in the patient. Similarly, antihypertensive, whose normal function is to decrease the BP, but may result in hypotension if the dose is more. Then type B, bizarre or unpredictable. Bizarre or unpredictable, they don't have any direct relationship to the dose of the drug or pharmacological mechanism of the drug action. They depend and they, develop on the basis of immunological reaction or genetic predisposition. They have a more serious outcome and result in more or higher mortality and morbidity and require immediate withdrawal of the drug. Then type C is chronic or continuous use. They are mostly associated with chronic intake of the drug. They are predictable and for example, prolonged use of NSAIDs can result in interstitial nephritis, papillary sclerosis, necrosis. Type D or delayed type. They are associated with the previous use of drug. For example, like patient has used the drug on certain time and may develop the toxicity or may develop the adverse effect in later period of time, like mutagenicity or carcinogenicity or teratogenesis comes in this category. Type E or end of use. This type of adverse effect appear when we suddenly stop the intake of drug. For examples, like beta blocker. Beta blocker are used to control the blood pressure, and they usually decrease the heart rate and blood pressure. But suddenly, if you stop the intake of drug, it may result in tachycardia and hypertensive emergency. These are also predictable type. Failure reaction, type F is failure reaction, means failure of the drug to produce response which may troublesome to the patient. Means if we take the drug for a certain purpose and drug not able to solve that problem, then it is called failure reaction. For example, oral contraceptive pills, what is its purpose? Like to prevent the conception. But if a certain patient take the OCP, certain female patient is taking the OCP, and also if take the anti-tubercular drug or anti-epileptic drug like rifampicin or phenytoin, these are actually the drug inducer. They induce the metabolism of contraceptive drugs. So its concentration in the blood decreases and the drug is failed to prevent the conception. So here the purpose of the drug intake is not solved, and so such type of problems comes in type F. Now there are certain terminologies which can be mentioned here, and we will discuss one by one, like side effects. What is side effects? These are the additional action of drug that may be desirable or undesirable in a specific situation. They occur at therapeutic doses and predictable. So when we talk about this adverse effect, they are always harmful and unintended, undesirable. But when we talk about the side effect, they can be desirable or undesirable depending on the situation. For example, if you are taking an anticholinergic drug for a antispasmodic purpose, here the anticholinergic drug causes the dryness of mouth, and at this time the dryness of mouth is not desirable, but it occurs. So this is side effect. But when you take the anticholinergic drug before the surgery, it decreases the secretion of the mouth. So here it is desirable. So this is side effect. Constipation. Similarly, another example is like when we use the opioid drug for analgesic purpose or for cough as an antitussive. Constipation is a common occurrence, and though we don't need constipation at here, but it occurs, and so here it is undesirable. But when you are using opioid as a for the control of loose motion or diarrhea, here the constipation is required or desirable. So side effects are the additional action which may be desirable or undesirable depending on the situation. Then secondary effects. These are the indirect consequences of primary action of the drug. For example, corticosteroid weakens host defense. For corticosteroid, we are using the steroid drug for anti-inflammatory purpose in inflammatory disorders. But it's another action that it decreases the immunity, because of which our patient may infected with the several disease, like there is an activation of the latent tuberculosis. So when we are giving the patient a drug for certain purpose, and because of that drug he get other problem, this is secondary effects. Then toxic effects. Toxic effects. These are the effects which appear when we use the drug in very high dose or over a prolonged period. These are predictable and dose related. They are pharmacologically related effects. And most toxic effects generally affects the CNS, CVS, kidney, liver, lungs. Toxicity, for example of the toxic effects, like there is a complete AV block by digoxin or bleeding due to heparin, etc. Then poisoning. Poison. What is poison? Poison is a substance which endangers the life by severely affecting one or more vital function. Intolerance. It is the appearance of characteristic toxic effects of a drug in an individual at a therapeutic doses. Some patient develop the toxic effect even at a therapeutic doses. This is intolerance. So it indicates a low threshold of individual to the action of drug. Example: very few patients develop ataxia to the carbamazepine. This is unpredictable type. Then idiosyncratic reactions or idiosyncrasy. It is a genetically determined abnormal reactivity to a chemical. The drug interact with some unique feature of individual not found in majority of the subject and produce the uncharacteristic reactions. For example, chloramphenicol in certain patients can result in serious, like threatening aplastic anemia, and that is not very common, and it occurs in only some population. Then drug allergy. It is called hypersensitivity, drug hypersensitivity. It is immunologically mediated reaction and unrelated with the pharmacodynamic profile of the drug. It generally occurs even with much smaller doses and have a different time course of onset and duration. Allergic reaction occur only in a small portion of the population exposed to the drug. History of prior sensitization may or may not be evident. The drug or its metabolite here act as an antigen of heptin and induce the production of antibody. Then come to photosensitivity. What is photosensitivity? It is a cutaneous reaction resulting from drug-induced sensitization of skin to UV radiation. These are two types of the reactions are two types, like phototoxic reaction and photoallergic reaction. Phototoxic. What do you mean by phototoxic reaction? Drug, or here in phototoxicity, drug or metabolites accumulates in the skin, absorb the light and goes photochemical reaction followed by photobiological reaction, resulting in tissue damage like erythema, which may appear as a erythema, edema, blistering, hyperpigmentations. Phototoxic reactions are more common with the shorter wavelength light. Then photoallergic reactions. Drug, here the drug or its metabolite induce a cell-mediated immune response. They produce papular or eczematous contact dermatitis like picture. Mostly light of longer wavelength responsible for this type of allergic reactions. Drug like, for example, a drug like sulfonamide, sulfonylureas, cresofilbin can cause photoallergic reactions. Then drug-induced diseases. What is drug-induced diseases? It is also called as iatrogenic physician or physician-induced diseases. An ill effect that persists even after the withdrawal of drug. The problem which persists, which occur due to the use of drug, the problem or adverse effect which occur due to the use of drugs, and it persists even after the withdrawal of drug. For example, peptic ulcer, which is due to the use of which can occur due to the use of NSAIDs. And once if you you stop the NSAIDs use or corticosteroid, even it persists, peptic ulcer require a treatment. Similarly, hepatitis by isoniazid or rifampicin, retinal damage by chlorophyll. Many drugs causes nausea and vomiting, but it is not iatrogenic, because once you stop the drug, the also nausea and vomiting also stops. So it doesn't come under this category. Then drug abuse, certain terminologies related with the addiction and dependence. So what is drug abuse? Refers to the use of drug by self-medication. Drug abuse is a use of drug by self-medication in a manner and amount which deviates from the approved medical and social pattern in a given culture at a given time. So many drugs can be abused, not necessarily like opioid or other. Many drugs can be abused, like analgesics or antibiotics. They can also be abused. Drug addiction. When person believe that optimal state of well-being is achieved only through the action of the drug, the subject feels emotionally distressed if the drug is not taken. There is a compulsive drug use characterized by overwhelming involvement with the use of drug. Procuring the drug and using it takes precedence over the other activities. Means the person is said to be drug addicted when he gave the priority to use of drug. He gave priority to the drug over the other important thing. The person is drug addicted. Drug dependence, physical dependence. What is physical dependence? It is an altered physiological state produced by repeated administration of drug, which necessitate the continuous presence of drug to maintain the physiological equilibrium. Means if it means a patient needs continuous presence of drug. Patient have to take the drug to maintain the physiological equilibrium. If the patient not get the drug, there is development of withdrawal symptoms. Drug producing physical dependence are opioid, barbiturate, and other depressants like alcohol, benzodiazepine. Then drug habituation. It denotes less intensive involvement with the drug, so that its withdrawal produce only mild discomfort. Consumption of tea, coffee, tobacco, social drinking are regarded as habitual. There is no physical dependence in habituation. And drug withdrawal. So what is when we must remember that when the person develop withdrawal reaction, we must say that person is dependent. So sudden interruption of the therapy result in adverse consequences, mostly in the form of worsening of the clinical condition for which the drug has been used. Like different example, like acute adrenal insufficiency may be precipitated by abrupt cessation of corticosteroid therapy. For like a patient is using the corticosteroid therapy for a long period for certain disease, and suddenly stop the intake of drug, may land into the acute adrenal insufficiency. Another example is opioid withdrawal reaction, like when the patient is taking the opioids for chronic or severe pain for a long duration, like generally in cancer chemotherapy or other. So patient take the opioids, and the acute actions like analgesia, the drug causes and provides the analgesia, euphoria, relaxation, sleep, decreased blood pressure, constipation, pupillary constriction, hypothermia. These are the acute actions or the effects of the opioid. But And when patient take continuously, these type of effects are seen. But if the patient stop the intake of drug, the withdrawal symptoms develop, which are like pain and irritability, which is just opposite to the action of the drug. Like if our drug is causing the analgesia, the normal effect of the opioids is analgesia. But if patient stop intake of the drug, the patient develop pain and irritability, which are just opposite. There may be hyperventilation, dysphoria, restlessness, fearfulness, increased blood pressure, diarrhea. So we see withdrawal symptoms just opposite to the action of the drug. Then what is teratogenicity? These are there are certain drugs which can cause fetal abnormalities when given to the pregnant mother. Drug can affect the fetus at 3 stages: fertilization and implantation. This period range from the period of conception to the 17 days. If the drug is taken by the female during this period, there may be the failure of the pregnancy, and which often goes unnoticed. Then the next period is very important period, and it is most vulnerable period, organogenesis. This is a period of organogenesis and range from 18 to 55 days. If a female take the drug or teratogenic drug during this period, deformities, major deformities can occur because organs are formed during this period. For example, like thalidomide can cause pecumelia. Anti-epileptic drug like valproate can cause neural tube defect. Warfarin can cause cutis, can cause warfarin syndrome, fetal warfarin syndrome. Then growth and development. The next period is growth and development. 56 days from 56 days onward. Development and during this period, the development and functional abnormalities can occur if the person take a drug. Developmental and functional abnormalities can occur. Like use of ACE inhibitor can result in hypoplasia of the organ. Or if the person take anti-thyroid drug, they may result in goiter can develop in fetus. Then mutagenicity and carcinogenicity. Certain drugs may form reactive intermediates which affect gene and may cause structural changes in chromosome. This is mutagenicity. So there are many there are different type of drug or chemicals. They react with the they form a reactive substance which affects the gene and causes structural changes. And later they can cause cancer. Even without interacting directly with the DNA, certain chemicals can promote malignant changes in genetically damaged cells, resulting in carcinogenesis. For example, anti-cancer drug, isotopes, estrogen, tobacco, and many. Then how can prevent the adverse effect? So we have seen the adverse events, adverse effects are more common when you practice polypharmacy. So one of the best thing is to avoid inappropriate use of drugs, or avoid use of many drugs when they are not needed. So avoid inappropriate use of drug. Appropriate drug administration means drugs should be given in proper dose and suitable dosage form for the right duration through proper route, using a proper technique and in right frequency. Always make a habit to ask for a previous history of drug reaction and allergies. And if adverse effect occur, always suspect ADR when new symptoms arise after initiation of treatment. And by chance, if adverse effect occur, ask for the go for the laboratory findings, which help to find out the organ affected and others. Then pharmacovigilance. Pharmacovigilance. What is pharmacovigilance? First, this is a science and activities related to detection, assessment, understanding, and prevention of adverse effect or any other drug-related problem. The information generated by the pharmacovigilance is used in educating doctors and the official regulation of the drug use. It is our responsibility. It is a responsibility of all healthcare or healthcare worker or all the person involved in healthcare to report the adverse effect. Whenever there is occurrence of adverse effect, we have to report because of this, because it helps in generalizing the data, and we can control the drugs which are producing adverse effect or more adverse effects. It has an important role in rational use of medicine, as it provides the basis for assessing safety of medicine. Thanks to all.